시작해 주세요.
네,
So she will show you the basic protocol with the new treatment, biomeso PDRN expert ample, but she will at the same time share her treatment tips with our products. 멘트 해주세요.
이무과 같은 경우는 우선은 눈시림이나 백탁 형상 형태가 없고요. 그래서 렌즈 끼신 분들도 굉장히 편안하게 받으실 수 있습니다. 그래서 한국 같은 경우는 판매를 이제 권장을 하게 될 때 직접적으로 한쪽 부분을 셀프로 지워보게끔 해서 유도를 하고 판매 부분을 하고 있습니다.
Yeah. So she has applied the cotton soaked with Skin Defender lip and eye makeup remover. So this makeup remover doesn't cause any eye stinging. And in Korea, to encourage home care sales, actually, our professional clients use just one side, one eye, and in the other side, they let the client try removal of the eye makeup, and then they can really feel how it is, and it's easier to sell.
다음 단계는 SOC입니다. 크게 펌핑 한 번으로 해서 리터치를 많이 하시지 않고 브러쉬로 해서 작업이 들어갑니다.
지금 한 번 펌핑 하신 거예요?
네, 크게 한 번입니다.
Yeah. So she did one full pumping of snow to cleanser, and yeah, in Korea we prefer applying this cleanser using a brush. 왜 브러쉬로 하시는지 말씀해 주세요. 한국에서
리터치를 안 하시게 되면요, 메칠법 플로우로 활성화가 훨씬 더 많이 일어납니다.
브러쉬로 하시면요?
네,
So Hannah is saying that when you apply this cleanser with a brush, the oxygen bubbling is more activated.
그리고 특히 예민 피부나 열감 가지고 있는 상기혈증을 가지고 있는 피부들, 예민 피부들 같은 경우는 버블이 훨씬 더 많이 올라오고요. 모공이 큰 여드름 피부는 이 부분에 대한 터지는 느낌까지 받게 돼서 약간 특수 관리를 받는 듯하다라고도 표현을 소비자분들이 합니다.
예민 피부나 그 열 있으신 분들한테 더 많이 올라온다고요?
네네. 그러니까 피부가 약간 극약의 아픈 피부들이나 건조한 피부나 이런 분들이 이 버블의 활성화가 훨씬 더 많이 올라와요.
And she's saying that on dry or on sensitive skin or skin with redness and on these kind of skin types, the oxygen bubbling is quite activated, more activated than ordinary, let's say, normal skin. And especially like for acne scar, like or dilated pores, and we can even hear like the bubble popping sound on the pores.
한국 같은 경우는 SOC 클렌저를 홈케어로 많이 판매를 하고 있는데요. 소비자들한테 안내를 해드릴 때 손 깨끗하게 닦으시고 드라이한 상황에서 이렇게 펼쳐지는 형태들을 많이 보여드립니다. 그래서 이렇게 도포하신 상황에서 양치질 3분 동안 하시면서 활성화를 시키게끔 홈케어를 사용하게끔 안내합니다.
And we sell a lot Snow O2 cleanser as a home care product, and like to teach them how to use. So we should firstly we should wash hands and dry hands, and we pump Snow O2 cleanser, and we spread on the face, and while they brush their teeth for 3 minutes, they leave the cleanser on the face.
SOC 같은 경우는 바로 제거가 들어가시는 것보다 이렇게 활성화시키는 부분에 대한 시간 부분을 좀 배치하시면 얼굴의 홍반이라든지 열감 진정 정도가 훨씬 더 뛰어납니다.
This cleanser works more fabulously when we leave on the skin like a mask. And as I said, on, let's say, skin which needs more, let's say, intensive treatment, like sensitive skin or dry skin or
이거 먼저 하네, 데모를.
then actually this is like an oxygen mask.
아, 그랬죠? 나 그걸 몰라. 무슨 메일로 들어왔는지 몰라가지고.
다른 분들 말씀하지 마세요. We leave it for a few minutes.
네, 지금 소비자처럼 메이크업, 포인트 메이크업을 하지 않았어도 포인트 리무버를 하는 이유 중에 하나가 저희가 조금 더 안정적인 저희 페이셜 스페셜 테라피를 하기 위해서 이고요. 보통은 메이크업을 하시지 않아도 제노시스 라인 부분을 이제 사용하시게 될 때는 꼭 포인트 리무버를 권장을 합니다. 특히 MTS나 오늘 들어가시는 스피큘 부분 관리가 들어가실 때는 꼭 전처리를 사용해 주십시오.
So today, our client didn't wear any color makeup on her eyes or on her lips, but Hannah has still used our makeup remover on the eyes and lips because it's part of Genosys protocol, and even on skin without color makeup, this cleanser makeup remover is doing necessary things on the lips and the eyes. So even on patient or clients without color makeup, please use start the treatment by makeup remover.
클렌징 단계 시작하겠습니다. 물을 손끝에 살짝 묻힙니다.
잠시만요. 김 차장님, 그
네.
SOC 몇 분 놔두는 게 좋아요? 3분에서 5분? 물어봤는데.
원래 이제 홈케어로는 3분 정도 활성화를 시키면 좋은데요. 지금 에스테틱 쪽 샵에서는요, 포인트
네.
리무버나 이렇게 이제 가정되는 진행 상황 후에 바로 들어가시면 돼서 1분 정도 내외가 될 것 같습니다.
So the question, so how many minutes with Snow O2 cleanser? For home care, 3 minutes is good. And for professional care, 1 minute.
그래서 들어가도록
She
하겠습니다.
wet the fingertips with water.
살짝씩 이렇게 하얗게 올라오는 거 보이실 거예요.
So we see another, let's say, layer of oxygen bubbles is occurring.
다시 한번 물기를 묻힌 상태에서 또 걷어냅니다.
She wetted again her fingertips and
두 차례 정도 해주시고 나셔서 충분하게 물기를 묻힌 후에 러빙이 들어갑니다.
and now with abundant water,
클렌징 작업 들어가시면 돼요.
you can do traditional cleansing manipulation with your hands.
한국에서는 SOC 같은 경우를 아토피 피부 아가들한테도 판매를 하고 있어서요. 바디까지 다 사용하게끔 안내를 하고 있습니다.
In Korea, Snow O2 cleanser is actually recommended even to kids with atopic dermatitis. So it's quite safe to use.
육안으로 보이시면 아까보다는 홍반 기운이나 이런 것들이 조금 정리정돈이 돼서 편안하게 보이는 게 보이실 거예요.
So we can see that the redness on her skin is less visible than before cleansing. I said kids with atopic dermatitis can use Snow O2 cleanser. I just answered to one question.
기다려요. 스노우 부스터로 해서 피부결 정리정돈, 그다음 pH, 수분 공급을 하겠습니다.
So using Snow Booster, she refines the skin and tries to do a pH rebalancing.
다음 전처리 작업으로 해서 EgCO2 마스크 작업 들어가도록 하겠습니다.
So as a pre-spicule treatment, Hannah is applying easy CO2 mask.
전후 처리로도 다 사용이 가능하지만 EgCO2 마스크 같은 경우는 지금 스피큘 단계 부분에서는 전 처리로 활성화를 시키는 부분에 좀 더 포인트를 주시고 진행을 해주시길 바랍니다.
스피큘 후에도 쓸 수는 있다는 말씀이세요?
근데 이제 자극도나 이런 부분 관련해서 전 처리로 했을 때 조금 더 안전한 포맷으로 사용하실 수가 있습니다.
Actually, even after biomesol treatment, carboxy mask can be used, but it will really cause very high irritation on skin. So our protocol is actually we use carboxy, so easy CO2 mask before applying biomesol.
튜브 하나를 다 쓰셔야 되고요. 특히나 이렇게 너무 얇게 펴바르시는 게 아니라 도톰한 형식으로 해서 좀 더 화산이 활성화가 잘 될 수 있게끔 두께를 보존을 좀 해주세요.
So, as you all know, one full tube should be applied on the face, and you don't need to spread like too thin, but it should be, let's say, thick enough. Okay?
특히 소비자들이 이제 요구하는 내가 이제 꽂혀 있는 뭐 예를 들어서 홍반이나 색소 부분이나 인중 부분에 대한 트러블성 부분에 대해서 조금 고민이 많다라고 하시면 그쪽 부위는 조금 더 도톰하게 형성을 시켜주시면 피부 재건 부분에 도움이 됩니다.
And during consultation, you better ask the clients what are their concerns. So, for example, if they say that they are quite concerned about the redness on the cheeks or some pigmentation on the philtrum, so like these, let's say, concerning parts, then you keep the thickness of the CO2 gel more than the other part. so that there can be more intensive carboxy effect on the problem part.
잘 아시겠지만 과립층 부분에서 탄산 마스크가 이제 뚫고 진피층으로 이제 들어가면서 자극도가 약 10초 정도 있습니다. 그래서 한국에서는 우스갯소리로 저희가 10초 참으면 10년 젊어지세요라고 이야기를 합니다.
So when the CO2 gas goes to the dermis through a stratum granulum, it takes around 10 seconds. So in Korea, like a joke, like a kidding, we say that if you stand for 10 seconds, then your skin will look 10 years younger.
얼굴이 조금 작으시거나 하실 때 혹은 코가 높거나 하실 때 살짝 쉐입 부분의 측면과 코 쪽 부분에 커팅이 들어가면 입체감 부분에 맞게끔 좀 더 밀착해서 마스크를 부착하실 수 있습니다.
And the CO2 mask, you can cut the part where you can cut, let's say like depending on the shape of the face or size of the face or shape of the nose, you can, like, by cutting the mask, you can really make a tight adhesion of the sheet mask.
깊이 이제 들어갈게요. 측과항 관련돼서인데요. 우선은 처음 들어가시게 될 때 가볍게 저희가 측면 부분에 마사지 하시듯이 풀어주실 수가 있어요. 브러쉬 같은 경우는 그렇게 활용도 가능하셔서.
And during this application of CO2 mask, she will perform a scalp lifting therapy, and she just showed how she's using our new product, scalp brush. Scalp brush is for actually being used with the shampoo, but if you want to perform this scalp lifting therapy, which is like an add-on treatment during a CO2 mask application, then you can, to stimulate the scalp before needling the scalp with products, you can use this silicone brush.
가볍게 이완할 수 있는 방법으로 사용하시면 되고요. 스캘프 필 들어가도록 하겠습니다.
So
네이프 라인, 목 뒷면 쭉 먼저 발라주시고 귀 뒷면 부분에 볼록하게 튀어나와 있는 부분서부터 저희가 0.3 정도 내외 부분으로 해서 이렇게 부채꼴 모양으로 작업이 들어가도록 하겠습니다.
So lymphatic drainage is an important purpose of this add-on treatment. And so behind the ear, like a fan, so like triangle, she will treat. Now she's using scalp peeling using the cotton bud, which is contained in our treatment kit, HR3 Matrix treatment kit. So 하나,
네,
그 스캘프 브러쉬요, 고객
네.
그러니까 여러 고객한테 사용할 때 어떻게 그 소독이나 살균할 수가 있죠?
저희 그냥 물 세정 1차 부분 하시고요. 에탄올 부분으로 해서 세정 가능하세요. 그래서 브러쉬 같은 경우는 뿌리는 형태로도 에탄올 부분 가능하셔서 에탄올 칠 때 물 3 이렇게 해서 분사하셔도 가능합니다.
The scalp brush actually is recommended for a home care tool for shampooing, but like Hannah showed, if it's used for professional purpose, then between clients you can so you wash firstly with flowing water, and then you can disinfect it using alcohol, ethanol. So like 7 to 3, so ethanol to water, and you can spray it.
자, 그 다음 단계로
So
저희가 니들 펜테이와 토너를 이용을 할 건데요. 간혹 두피가 너무 예민하시거나 딱딱하신 분들은 토너보다는 솔루션을 사용하시는 게 좀 더 안정적입니다.
So she will do needling with our needle pancake and hair tonic alpha, but on the scalp, which is a bit too hard and 그러니까 딱딱하거나 뭐라 그랬죠? Hard.
홍반 기운 이제 너무 많으시거나 할 경우 자극도가 있어서요. 네.
The scalp with quite high redness, then erythema, you can use hair solution alpha instead of hair tonic.
니들 처음 들어가실 때 처음부터 0.25 사용하시지 마시고 0.25보다 안쪽으로 해서 회전 속도는 5,500 rpm으로 소리가 적은 부분에서 모니터링을 하시고 소비자가 오케이를 하시면 조정이 들어가겠습니다.
So to start with, the length needs to be under 0.25 millimeter, and the speed needs to be slow, so with around 5,500 RPM.
그래서 후두부 쪽에 저희가 짧게 니들링이 들어가면서 소비자분이 괜찮으신지를 모니터링을 하고요.
So back of the head, you do very short strokes, and you ask the client if they feel okay.
그래서 괜찮으시다라고 하면 저희가 0.25와 스피드를 최대치로 해서 최대치일 때 소비자가 조금 더 편안하게 받으실 수 있음을 기억하시고 들어가시면 됩니다.
If the client is okay, then now adjust the length to 0.25 millimeter and the speed, highest speed, because at the highest speed, the comfort level of the client is actually better.
시술은 짧은 형태의 스탬프 형식과 거의 가깝게 해서 가로 세로 십자열 모양으로 들어가게 됩니다.
So, first, it's like, firstly, let's say vertical and then perpendicular. So like drawing across, short strokes, almost like stamping.
저희가 이 프로그래밍을 그 탄산 마스크와 결합하는 이유가 얼굴 쪽에 산소 공급을 하면서 두피 쪽 부분에 림프 순환과 산소 공급을 도모하는 역할을 해서 얼굴에 홍반 기운을 빼거나 리프팅 라인 부분과 관련돼서 굉장히 드라마틱한 효과가 납니다.
So, why we are performing this treatment? Because while delivering more oxygen to the skin, facial skin, using CO2 mask, we can, so by doing this scalp stimulation, we can improve the lymphatic drainage and also oxygen delivery to the scalp part. And finally, the lifting effect of the facial line is improved, much more improved, and also like erythema, so redness of the skin is really calming.
이렇게 시술하시고 나셔서 토닉 뿌려주시면 되고요.
So after needling, you apply tonic.
그리고 탄산 마스크를 가볍게 눌러주시고
스캘프 리프레셔는 어느 단계에서 쓰시죠? So she just pressed the CO2 easy CO2 mask on the face.
스캐브 리프레셔는 이따 마스크 팩하고 나서 진행할 거고요. 이렇게 하고 나서 이제 반대편 부분에 대한 것까지 해서 마무리 지시면 됩니다. 측도.
오늘은 안 하실 거죠?
네, 지금 오른쪽만 진행하겠습니다.
So you do the other half, and so this scalp lifting treatment, which is an add-on treatment, which you can perform during the application of CO2 mask, you can finish it Now, so today we skip the other part.
한산 마스크 제거 들어갈게요.
She will remove the CO2 mask.
많이 밀착하셔서 쭉 끌어당기시면 됩니다.
So using the spatula, you really stick to the skin and you remove the gel.
간혹가다 예민 피부분들한테 적용을 해도 되냐 이런 이제 소비자분들의 질문이 있습니다. 근데 이제 저희가 이 예민 피부나 질식한 피부들, 상황이 안 좋은 피부들에 산소 공급을 해주게 될 때 훨씬 더 피부 세포 재생과 관련돼서 원활한 효과를 가져오기 때문에 그 부분을 소비자분들한테 조금 강조를 많이 해주셨으면 좋겠어요.
Sometimes we receive questions about this CO2 mask. Can we use on sensitive skin? The answer is yes, because our intention of using this product is to deliver oxygen in the skin with carboxy. So when the oxygen supply is improved in the skin, actually more all the skin condition is really improved with nutritions, more nutritions, yeah, so we can use on sensitive skin.
게다가 기계 장비 같은 것들 많이 받으신 분들 같은 경우 피부 조직이 얇아지셨거나 나이, 연배가 있으신 분들은 탄력도가 떨어지게 되는데 한산하시고 나면 탄력도 붙는 정도나 지금 보시면 피부결 정리 정도 된 게 보이실 겁니다.
And clients who receive a lot of EBD treatments, like a lot of device treatments or very thin skins or mature skins, with this carboxy mask treatment, their skin condition and also like lifting of the skin is improved. So this is really like multi-potent treatment on different types of skin.
물을 이용해서 제거 작업 한 번 더 들어가도록 하겠습니다.
지금 손가락으로 물 이렇게 하셔서
네, 한번 하고 이렇게 이제
So just with a bit of water, you do like a simple massaging, but it's for removing the gel, which is quite hard to remove. So this is actually her tip. So you add water and you massage a bit, and then using the spatula, you
이렇게
remove.
물을 이용하시면 해면 작업 하시게 될 때 훨씬 더 제거가 용이합니다.
With this step, it's much easier to remove the remnant of the gel using sponges or towels afterwards. This is really practical.
스펀지에 약간 물기를 가지고 있는 상황에서 제거가 들어가겠습니다.
So using wet sponges, now cleanse the remnant of the gel.
물기를 한번 짰고요. 그래서 약간 꼭꼭 눌러주듯이 제거가 들어가고 있습니다.
She removed some water of the sponges and now, yeah, cleansing again.
그다음에 냉스포 사용하겠습니다.
And now she's using a cold towel, wet cold towel, not hot towel.
다시 한번 부스터로 정리 들어갑니다.
So once again, using Snow Booster, we refine the skin.
Úder pomalili jen o několik měsíců. Washington tvrdí to první, podobně jako Jeruzalém, který podnikal nálety na zařízení.
Turn off the microphone. Who's speaking?
피부 정리 정도는 해주시고 본격적인 스피큘 PDRN 들어가도록 하겠습니다.
사장님, 저희가 이제 마이크로 니들링이었으면은 소독을 하잖아요. 근데 이제 우리
네.
여기 소독 안 하고 지금 스피큘 들어가는 거죠?
네네네.
So if it was a micro needling treatment using rollers or device, then we should disinfect the skin at this step. But now, Hannah, without using a disinfecting solution to sterilize the skin, she will apply the Biomeso PDRN Expert Ampoule, 60,000.
가볍게 분배하셔가지고 네, 우선은 먼저 주사기 돕고 들어가도록 하겠습니다.
So our product doesn't have like spicules. So Jillian will deliver the lecture later. But so spicules are the materials which are contained in this ampoule. But so our product doesn't have separate spicules and serum, but it's all mixed in the product already.
작업 들어가도록 하겠습니다. 1단계입니다.
So the first
가볍게
step,
도포해 주시면 돼요.
you spread lightly. And you need to warn the client that they will feel like stinging sensation, pricking sensation. 이거
실질적으로 약간
하기
네,
전에
말씀주세요.
고객한테 고객이 이제 따가움을 느낄 거라고
네네네.
해주고 말했어요.
네네. 그리고 실제 홍반 기운이 너무 많은 그 주사 피부라든지 염증성을 많이 가지고 있는 피부는 예, 작업 부분에서 제외됩니다.
And severe rosacea and inflammatory skin are contraindications.
2차 두 번째 단계에 들어가도록 하겠습니다. 약간의 밀착을 통해서 테크닉이 들어갑니다.
Second step, as if we really need to insert these spicules, so biomeso materials, into the skin, you press.
빠르지 않게 들어가시는 게 예, 포인트입니다.
Slowly, really, so using your fingers, you stick to the skin and press to spread. Yeah, this is a new product. So this is why we are doing this training session. We will introduce this product after this demo. So Marlene asked the question. So the first step is spreading without pressure. And this second step, spreading and inserting with pressure.
그래서 가볍게
But
그
slowly.
피부층 안쪽으로 집어넣는 작업을 1차적으로 해주시고요. 피부 조직이 너무 예민할 경우에는 2차 작업에서 끝내주시면 됩니다.
On quite sensitive skin, protocol-wise, this second step will be the last step of the application. There won't be the third step, but on, let's say, normal skin, the third step will be performed. 차장님 잠시만요. So now
네,
there are some participants who ask us, okay, what is this product? So in the beginning, I have mentioned, but maybe not everyone was there. So today we had to deliver the theoretical presentation first, but since it's a bit too late in Korea, where our headquarter team is located, so we do the demonstration first, and after this demonstration, we do the theoretical part, and you will learn about the products. So Hana is applying the Biomeso PDRN ample 60,000. So the first step, spreading without pressure. The second step, spreading and let's say inserting with pressure. And once again, on quite sensitive skin, we stop the, let's say, the application of the ampoule, but on, let's say, ordinary skin, and for more intensive effect, we do the third step. 지금 3차 하시는 거예요?
아니요, 2차 단계 부분에 러빙 동작 들어가고 있고요. 그다음에
Mhm.
3차 부분 다시 한번 HSC 도포를 해서 러빙 동작 들어갑니다.
So she's just doing more hands manipulation to make the materials to be inserted in the skin. This is still the second step.
세컨 스텝이요.
Yeah.
피부로 눌러주잖아요.
네.
그 다음에 마사지 하는 거예요.
네네네. So the second step is pressing slowly and then doing a massage. So pressing and massage. And the third step starts for more intensive treatment. So this
가볍게
is
준비하셔서
soothing cream. The name of this product is Hydro Soothing Cream, but in this protocol, this is not really working as hydro soothing, but this is for enabling more intensive treatment effect. This, let's say this is like an occlusive dressing. So we block the skin from the outer environment using this kind of film layer, and more, let's say, effective penetration of biomeso can be done with this third step. And the effect also, when we look at the effect, it's more intense. 홍 부장님, 지금 느낌이 어때요?
지금은 조금 나은데요. 크림하고 같이 누르니까 아까 크림 전까지는 되게 아파. 조금 뭐라 그러나? 살이
지금 더
2차
아파요?
스텝에서는 좀 많이 아프셨고요. 지금은 조금 편안하시대요.
Uh-huh. So I just asked the client how she feels. We didn't really see that like she had any pain, but she said it was very painful on the second step. And now with actually hydro soothing cream, sensation wise, she says that it's not too painful. 그렇지만 아프죠?
조금 아요.
이거 그 전에 해보셨죠?
아니 처음이야.
처음. I think she has quite high threshold of pain. It's the first time she's receiving this particular treatment, and I asked her the pain level, and she said it is a bit painful. But she has actually received a lot of different kind of aggressive treatments before. So 그러면은 이 고통의 그 뭐지? 정도를 10점 만점으로 몇 점?
크림 전에는 12, 10.
10?
두 번째 스텝 때는 10.
네.
세 번째 스텝
때는 한 4.
4.
I just asked her to measure the level of pain out of 10. So she said during the second step, it was 10 out of 10. And during the third step, it's 4 out of 10. But I really didn't think that was like that painful for her because I didn't really see any change on her face, but it was quite as painful.
그다음에 저희가 진정관리 부분으로 해서 마스크, 네, 에이징 파인 파우더 마스크 들어가도록 하겠습니다. 스푼 하나.
As
말씀해주세요.
a coming mask step, she's using the bioferment age-define powder mask. So 1 full spoon of this powder mask.
그리고 물 같은 경우는 1.5배로 들어가게 됩니다.
So the ratio of the mixture of the powder and water is 1 powder and 1.5 water, because this product is using top quality diatomaceous earth, and it really absorbs a lot of water. So the ratio of mixture comparing to conventional modeling mask is a bit different. So 1 powder, 1.5 water.
그리고 저희가 눈은 피해서 들어가기 때문에 모델링 마스크를, 그래서 눈가 부분에는 아이 패치를 붙이도록 하겠습니다.
And as Jillian has written on the chat box, this Biomeso PDRN ampoule, expert ampoule, is not applied on the lips and on the eyes, so we didn't anyway apply the product there. And this powder mask also won't be used on the eyes and lips, so she's using with our eye gel peptide patch. She's covering the eyes. 물 온도는요?
네,
찬물?
그냥 차가운 물, 기본적으로 정수물 사용하시면 되고요. 약간의 쿨링감 있으시면 또 좋습니다.
The temperature of water, actually, we use normal, let's say, water from water fountain. So, but if you want really, it's a cooling effect, you can use cold water.
실질적으로 파우더 믹서에서 이렇게 보시면 되게 질척해요. 흘러내리는 듯한 느낌이 많이 듭니다.
So when you mix the powder mask with water, it doesn't look really thick, but it's quite fluid.
하지만 절대 도포했을 때 흘러내리거나 그러지 않습니다. 제노시스의 특징입니다.
But when you apply on the skin, it doesn't flow, it doesn't drop. So Lauren's question, 차장님?
네.
아일랜드에서 질문한 게 이제 그 바이오메소 그 프레스 할 때 이렇게 두드리는 그게 좋은지, 아니면은 그냥 그 압을 줘서 마사지를 하는 게 그 침투에 더 좋은지.
침투에 관련돼서는 실질적으로 밀착하셔서 안에 집어넣는다라는 개념이거든요. 그래서
네,
두드리는 형태보다는 네,
네.
지금 저희가 사용하시는 방식대로 밀착하셔서
음,
예, 천천히
mhm.
집어넣는 형태의 느낌처럼 가시는 게 좋습니다.
So if you look at the chat box, Lauren asked the question. So would there be any benefit in using tapotement movements to press the biomeso PDRN ampoule into the skin, or would pressure with massage the best application for
Pressure.
absorption? So Hannah just answered that. This is like we want to insert this liquid needle into the skin. So like tapping, so tappement is not really recommended, but you really stick your hands to the face and do a gentle massage for absorption, as she did.
에이징 파우더 마스크는 15분에서 20분까지도 도포가 가능합니다. 굉장히 많은 수분감을 가지고 있기 때문에 네, 활성화하는 데 있어서 도포 시간을 지켜주시면 좋습니다.
So the application time of this bioferment age-defying powder mask is from 15 to 20 minutes. For information, we had an inquiry about this mask. Okay, how is it different from hydro cool modeling mask? So hydro cool modeling mask, in terms of the cooling sensation, hydro cool modeling mask is better. But bioferment age-defying mask is really focusing on moisturizing and also nourishing the skin. So actually, after this biomesopediRN expert ampoule treatment on let's say the skin with high level of irritation, this mask is recommended. And then we will also introduce the new sheet mask today, and maybe yesterday you should have received or the day before yesterday the information, or maybe not yet. So Skin Reboot PDRN mask pack will be introduced. And so at this coming step, you can use either this powder mask or Skin Reboot PDRN mask pack. But for more, so on skin which has higher level of irritation, this mask is more recommended.
기다려야 돼. 아니면 제거를 깨고 넣어봐.
So you
시간
can
관계상 네, 말씀하세요.
아니에요. You can ask questions on the chat box during this application time.
시간 관계상 이거를 제거하고
네.
PDRN 마스크팩을 보여드리도록 하겠습니다.
네. 그런데 제거가 이게 응고가 안 돼도 바로 돼요?
네, 방법이 있어서 가능하게끔 하겠습니다.
Today, because of time issue, she will remove this mask and then she will show you another option for the mask, Skin Reboot PDRN mask. So even if it's not yet, let's say, hard enough to remove, she can still remove. So 차장님 질문, 왜 목은 하지 않나요?
저희가 스피큐를 이제 사용하시게 되면 목쪽 부분에 이제 옷깃에 닿거나 할 때 움직이면서 계속 까끌까끌한 느낌들이 납니다. 그래서 되도록이면 데콜테나 목쪽 부분은 네, 피해 주시는 게 좋습니다. 자극성을 떨어뜨리기 위해서입니다.
진짜 원하면 해주지만 아니면은 안 한다고.
너무 자극적이에요. 그렇다고 얘기를 하시더라고요. 네.
So why we don't do this treatment on the neck and décolleté? For your information, this is actually many products have their nicknames. This treatment is actually called with a special nickname. It's a dam treatment because after this treatment, each time you touch your skin, you feel like, oh, ouch, it's like this. So if we apply this product on the neck and décolleté, and if you like if anyway your clothes, your shirt, your blouse touches the neck and décolleté, it's really irritating. It's not comfortable. So that's why we don't do neck and décolleté treatment. But if someone wants really wants to improve the neck and décolleté, then they can, but they need to be careful for, let's say, 2 to 3 days. Okay, Christina, so if you by using 차장님, 그
네.
피부에 이 바이오메조 할 때 마사지 해야
네.
돼요?
실질적으로 그냥 도포만 하는 거와 저희가 테크닉이 들어가서 스피큘이 안쪽으로 침투하는 정도 부분은 진피층 리뉴얼에 관련돼서 완전히 확연하게 결과물이 달라집니다.
네. 그래서 예민 피부
그래서
마사지 해야 된다고.
재생과 관련돼서 드라마틱한 이제 효과 부분 저희가 스피큘 지금 전문 과정으로 들어가는 이제 6천이죠. 이거는
정말.
네, 1.0 정도의 1.0mm 정도의 MTS 효과를 구현하거든요. 근데 테크닉이 들어가지 않으면 그만큼의 구현이 이루어지지 않습니다.
So with our protocol, it has the, let's say, the equivalent effect of 1 millimeter microneedle treatment. So, but on the condition that the biomicroneedle is inserted into the skin. So without massaging, the insertion of the biomicroneedle is not achieved. So as if you do microneedling treatment, even on sensitive skin, you need to do the massage with the ampoule. So here, like gentle pressure massaging is like microneedling.
좀 전에 보셨는지 모르겠는데 제가 이제 에이징 모델링을 제거할 때요. 너무 힘들어 하셔서 발가락을 계속 움직였어요. 그 정도로 굉장히 자극적이기 때문에 저희는 되도록이면 목 쪽이나 데콜테는 권장하지 않습니다.
When Hannah was removing the modeling mask, anyway, so she was touching the client's skin. So each time when she was touching the skin, she was like moving her feet because of the pain. So the neck and décolleté, we recommend you to avoid. 그리고 하나 더 질문, 지금 닥터 마리아 보스코가 방금 그 우리 파우더 마스크 제거하실 때 뭐 올리고 제거하셨냐고. 그 하얀 거 뭐냐고.
해면입니다.
해면?
일회용 해면이요. 한국에는 일회용 해면이 있어요.
일회용 해면.
그래서 좀 위생적인 일종의 티슈 같은 거. 근데
So,
원래는
그거 항상 쓰세요?
아니요. 지금 저희가 모델링이 다 건조되고 소요 시간이 진행되지 않은 상태에서 이거를 이제 보여드리는 거잖아요.
Okay.
그렇다 보니까 제가
Okay.
이제 제거를 하기 위해서 이제 도구를 사용한 것뿐입니다.
Okay. Dr. Maria Boscovich has asked a question. So when Hannah removed the powder, so bioferment age-defying powder mask, she used something white. So, okay, she used a disposable sponge. Okay, for hygienic issue in Korea, we use a lot of disposable sponge. And today, so if the powder mask was dry enough, and then it's easy to just peel off, to remove it. But today we didn't leave the mask for enough time, so that it's really dry and easy to peel off. So she just used the disposable sponge to stick to the powder mask.
지금 보시면 약간 벨벳이 밀착되듯이 시트 부분이 굉장히 얇고요. 에센스를 많이 머금고 있습니다. 비건 시트입니다. 그래서 예민 피부에 적용하기가 되게 좋습니다.
So she's showing another mask option. So this is Skin Reboot PDRN mask pack. So today, so later on, Jillian will introduce you this product. This is really thin. It looks like really velvet mask, but with it's different from velvet mask, but it's really containing a lot of active ingredients, and it's quite moist, but it looks like second skin because it's ultra thin mask.
10분 적용하시면 되고요. PDRN 성분 자체가 1000ppm, 판테놀 1000ppm, 그래서 굉장히 고함량으로 해서 진피층 리뉴얼되는 이제 최상의 궁합으로 배합이 되어 있는 특수 마스크입니다.
So 1000 ppm PDRN and 10,000 ppm panthenol and other active ingredients are contained. This is yeah, our new sheet mask. Application time 10 minutes.
네. 시간 관계상 제거하고 마무리하는 거 보여드리도록 하겠습니다.
So she will remove it because of time running. We don't have enough time today.
제거하시고 나셔서 열선 있는 손으로 두드리지 마시고요. 그럼 되게 자극적이거든요. 그래서 스펀지를 이용하겠습니다. 그래서 흡수, 유효한 성분들, 남아있는 것들, 에센스 흡수시킵니다.
To do a finishing treatment, avoid using your hands, which have our body temperature. It's hot. So on the skin, it is irritating. So don't use your hands to do the finishing treatment, but using a disposable sponge. Kind of, yeah, puff. 차장님, PDRN 마스크랑
네.
그 아까 파우더 마스크랑 어떻게 구분해서 쓰는지 알려주세요.
조금 더 많이 건조하거나 주름에 대한 리프팅이나 이런 부분들을 이제 원하시는 분들 같은 경우는요, 에이징 쪽으로 가시는 게 훨씬 더 유리하시고요. 실질적으로 PDRN 같은 경우는 조금 이제 홍반 기운이나 여드름성 흉터 관련이나 이런 이제 재생과 관련되어 있는 진피층 부분에 특히 어떤 문제성이나 이런 것들을 리뉴얼할 때 유효하긴 합니다. 근데 사실 상호 보완적으로 각각의 장점들은 다 있기 때문에 사람들의 사용감이나 소비자들이 원하는 형태 부분에 따라서 선택하셔도 무관합니다.
그리고 그 파우더 마스크는 이제 더 자극이 심한 사람들한테 더
네.
좋다고 들었거든요.
네, 그렇게 말씀해 주세요.
Yeah. So, a question from Marlene. So, when do you choose this PDRN mask instead of the powder mask? So, firstly, as mentioned, the powder mask, so bioferment age-defying powder mask is better when the irritation level of the client is quite high. Okay, so we can leave it for 15 to 20 minutes. It's really moisturizing and good for mature skin too. And the PDRN, Skin Reboot PDRN, the sheet mask, is good for, in general, this mask is good for, let's say, regenerating the skin, for also for skin with redness and etc. And the application time of this mask is, since it's very thin, it's around 10 minutes. So after biomeso treatment, if the client feels not too irritated, you can use PDRN mask. It goes also well with the biomeso PDRN ampoule. So ampoule with PDRN and spicules, and the mask with also PDRN, it's quite matching, it's good. But if the client is saying, oh, it's too painful, etc., then you can use the powder mask. And will
퍼프
that...
이용해서
네.
네.
야,
먼저
하세요.
말씀하세요.
하세요.
퍼프 이용해서 포스트 크림 발랐습니다, 이미.
So Hannah
그리고
applied
들어가도록
soothing
하겠습니다.
repair post cream using the sponge, and now she's applying. This is BBC.
네네. 이렇게 섞었습니다.
She blended the sun cream and intensive blemish balm cream. So she's applying the two together. So another question from Marlene, will that fill more than this mask because of the occlusion effect? Maybe Marlene, can you speak? You can, yeah. You can ask questions because I don't really...
Sorry, I couldn't find the the unmute button. What I meant with if it would feel more, even though it's calming and nourishing, I call it the powder mask now, I'm sorry, but the anti-aging mask, I thought of, since it's more occlusive than the sheet mask, if that would also enhance the depth of the treatment and the feeling afterwards and so on. I'm sorry, I confused you.
Okay, so when you mean feel, means let's say like more effect?
Oh, sorry. Would it be a more effective
Irritation?
treatment, like when we applied the Hydra soothing cream? You said this is gonna not be so soothing because it's gonna be an occlusive effect for the treatment. Would also that be with the powder anti-aging mask, because that is also a rubber mask, so it's going to be more going into the skin.
So you are saying by using powder mask, which is a modeling mask, so the insertion of or penetration or absorption of the spicules will be deeper? Is it?
Exactly.
Yeah, okay. 김 차장님, 그 질문이 이 파우더 마스크 일단 그 두 개를 어떻게 다른지 설명을 해줬는데 그러니까 파우더 마스크를 하면 스피큘이 더 깊게 약간 침투하는 효과도 있는지.
네네. 마스크나 지금 마무리 단계 때 것은요, 실질적으로 약간 진정 단계 부분에 대한 포커싱이 더 많습니다. 그래서 재생과 관련되어 있는 부분에 이제 도와주게, 온도 힐링에서 이제 염증 단계에 대한 발현 부분을 진정시켜주는 개념들이 더 크기 때문에 실질적으로 그런 침투 부분에 관련된 건 아싸 마사지를 구현하고 안 하고 그다음 HSC를 사용해서 마사지를 구현하는 거 아닌가? 여기가 더 포커스라고 생각해 주시면 될 것 같습니다.
So, like the penetration depth-wise, she says the indicators are actually the criteria which change this is the second step and third step, pressure massage, and also whether you use a HSC cream and you do a massage or not. But the mask step is focusing more on, calming, soothing, moisturizing, regenerating, etc. But maybe now it's clear. Yeah. Okay. 그리고 우리
네.
이 쿠션은 바르고 고객한테 주는 거죠.
고객이 사거나 하는 거에 대한 이야기를 하긴 하는데요. 지금 제가 이제 쿠션을 도포한 이유가요. 이렇게 반쪽만 지금 제가 발랐습니다. 근데 이렇게 홍반 기운이 있는 상태에서 햇빛 부분이 투과되거나 하면 PIH라고 하는 색소 침착이 생길 수가 있는데 선과 비비를 바르긴 했지만 완벽하게 재생과 관련되어 있는 저희 제노시스 쿠션을 사용하시게 되면 얼굴에 대한 리뉴얼, 재생을 돕기도 하고요. 그 다음에 이런 PIH가 생기는 것들을 삼중창으로 막으실 수 있기 때문에 꼭 요 쿠션 사용 부분을 좀 권고드립니다.
Okay, she applied the blended sun cream and BB cream on the full face, and just on the right half, she applied our skin caring BB cushion, because on her red, like the skin with the erythema, if she goes under the sun, there is a risk of post-inflammatory hyperpigmentation. So if you use the cushion also on top of sun cream and BB cream, then it's like a 3-layer sun protection, and it's really assuring in terms of prevention of post-inflammatory hyperpigmentation. So this is why she's showing that it's really important to use the cushion also. So after this professional care, the cushion will be offered, so will be given to the client.
이렇게 해서 마무리 짓도록 하겠습니다.
Okay, this is it. 홍 부장님 예뻐요. I just told the client that, oh, you look great.
웃어주세요, 스마일.
Okay, so 차장님 말씀하실 거 있어요?
아니요, 감사합니다. 잘 활용해 주시길 부탁드립니다.
So thank you. So this is it for the demonstration. Now we go to
이거
scalp refresher. Scalp refresher. So maybe this is not very familiar to you because it's an aerosol product. So it means freight cost is quite high. So actually in Europe, the registration was not done, and so it was not really available in Europe. But we recently realized that if you discover this product, you just love this product. So we decided to register this product in the EU, and we will launch it. So we are showing this to you today. This is a carboxy scalp refresher. This is like a all-in-one product. This is like a mask with
보통 저희가 그
Mhm.
예, 마스크팩 얹어놓고 사용하시는 게 가장 좋습니다.
So actually, it's really good to use on the scalp when you have your, let's say, calming mask. For example,
충분히 흔들어
for the PDRN mask. Then on this treatment step, you can use on the scalp.
충분히 흔들어 주시고 측면 부분, 그 다음에 두정부 부분의 백회 부분, 후두부 이렇게 넣어 주시면 좋아요.
이거 소리가 중요하거든요. 바로 앞에서 들려주세요. 나오는 거. 손등에다 테스트 해주세요. It's a pity because we don't hear the sound, because the sound is important. I can show you a video a bit later of a Korean top model who is also actress. Recently, we discovered that she was using this product on her YouTube channel. We didn't ask her to promote the product, but she was just using it, and oh, she's using our product on her scalp. Like at the end of a long, tiring day, but to relax by herself, she was using it on her scalp.
샵에서는 이렇게 마스크 할 때 이제 활용을 하지만 일반 분들한테 저희가 판매를 하게 될 때는 야외 활동 액티비티, 그러니까 골프나 테니스나 그다음에 등산을 하실 때 상기혈증이 먼저 이제 두피 쪽에 생기기 전에 저희가 도포를 하고 모자를 쓰고 야외 활동을 하시게 되면 열감을 떨어뜨려주고 모발을 증량하는 데 굉장히 도움이 되는 기능성 제품입니다.
This scalp refresher is great when you do especially an outdoor activity like playing golf, playing tennis, climbing, going to a mountain. So before you start this kind of activity, intensive activity under the sun, then you apply on the scalp and you wear a cap, a hat, then you do your activity, then really it cools the scalp and hair. It doesn't make your, let's say, it really prevents hair loss, and it's really good for the health of scalp and hair.
It's done. 끝났습니다. 감사합니다.
Thank you. 고마워요. Bye.
Bye.
Bye, Seoul team.
Bye.
See you soon.
So Jillian will
Thank you very much.
Thank you.
것 같아요.
근데 이거를 아프다, 안 아프다 이렇게 얘기를 하면 안 될 것 같아요. 아픈 거는 아픈데.
마이크 꺼주세요. So Jillian will share the presentation, and now, yeah, so she will introduce you the new products.
Are we all happy and ready to begin? No more questions before I start?
So the last question from Christina was, after the treatment, for how long the sensation will last on the client's skin? It's included in the presentation, so you will discover. Okay, I let Jillian then speak.
Thank you and welcome everybody. Thank you, Hannah, for the demonstration. It was fantastic to see the brand new product in action. And I think you can all agree the fact that her skin looked absolutely amazing immediately after. So I'm sure she's going to get fantastic results. So we bring to you today 3 brand new products.
I'm sorry, Jillian. I'm sorry. Okay, now I see you. Okay, good. Everything's fine.
Okay. I was hiding. So we have 3 new products today to bring to you. And the focus with all 3 of these products is an ingredient called PDRN, or polydeoxyribonucleotide. Now, this particular ingredient has gained a lot of popularity, I would say, specifically over the last couple of years in the UK, in the form of injectable polynucleotides. So again, over the last couple of years, PDRN as a product ingredient, again, has gained quite a lot of traction in terms of its superiority and exactly what it can achieve. So the main 2 products that we'll cover, first of all, will be the expert PDRN ampule that Hannah has shown you through today. So we want to look a little bit more into what ingredients are in there, exactly how the spicules are extracted, and how they work on the skin as well. So I did see a lot of questions at the beginning. We will be covering all aspects.
I'm sorry, Gillian, for interrupting you. I just wanted to know if you could share this presentation in the chat box so we can make notes while you're speaking. Is that possible?
I'm not sure I'd be able to do that. Is that something you could do, John Wei?
Oh, on the chat box,
If you can, yeah, or if you can send the presentation so we can make notes while you speak directly in the presentation.
Is there a function that I send the presentation to all the
I think there is I'm
File.
sorry, but this
File.
is me. Yes, if you in the chat box, you could press the plus sign.
Yeah.
And there you can choose to attach photo or presentation.
Yeah, okay, hang on.
I'm sorry. I really appreciate it because I want to make notes on the slide if that's possible.
So everyone, you can download the presentation. It's done now, so you can download the presentation and you can take a note.
Thank you.
Okay, you see it?
And not yet. Maybe it takes a while.
No. My mistake. I just sent it to Elisa only. So
Okay.
to everyone. Elisa is special. Okay, now I sent to everyone. Okay.
Oh, thank you so much.
Yeah,
I'm sorry for
received it.
interrupting. Awesome. Thank you.
Okay, you download the presentation file and then you take a note. So Gillian? Yeah, please. Now you can continue.
Thank you. So something that I certainly notice in clinic in terms of client expectation, and I think generally in the aesthetic field as a whole, we are always looking for more innovation in terms of how can we deliver results with less. And by that, I kind of mean we want good results, collagen production, skin regeneration, but a lot of clients want less intensity, less downtime. So this is quite difficult sometimes to actually get right. So this is why this particular product is particularly innovative. So as I mentioned, all three of the products that we covered today will have that PDRN element to the ingredient formulation. But these two products specifically, so the Expert Ampule and the Home Care Ampule, have the addition of the Speedcule technology, which was touched upon in the demonstration. So that is specifically what I want to look at today and explain how those Speedcules actually work. And I think one of the questions that was asked is, how long do they stay in the skin? What's sensation like? How long does the sensation actually last? So this is all going to be covered in the following presentation. I think somebody's having difficulty opening the file.
I sent the file directly to this person, so you can continue.
All right, okay, thank you. So here we are looking at, first of all, the Expert Ampule, which you've just seen in action. So we call this the Genosys Biomeso PDRN Expert Ampule 60,000. So both of the Speedcule products have a number attached to them, and this number will tell you the exact concentration of Speedcule. So that number essentially is how many Speedcules or what concentration of Speedcules is in each of the individual ampules. So Genosys have created a unique therapy using a Biomeso PDRN ampule. So these two ampules utilize Speedcule technology, And spicules are completely natural, extracted from marine sponges, and they are microscopic needle-like components. So it's very important when you are training with this product, when you are encouraging marketing of this expert treatment, that you market it as no needle microneedling treatment or bio microneedling treatment. Either of those would properly explain what the treatment does and what it is for. So we could say that this treatment is beneficial to those that perhaps are new to aesthetic treatments and also maybe a bit fearful of using microneedles as a form of treatment. So anybody that's nervous in that sense, but as I said at the beginning, still wants that innovation, still wants the results as you can get with a microneedling treatment, then this would be ideal for that person. As you've seen in the demonstration, although actually she had zero reaction, you really do feel the sensation. So although I say it's great for people that may be fearful of needles in treatment, you might have to be quite wary of those that are low pain tolerance, especially. So it's quite important that you look at client selection quite carefully. So the spicules themselves, so spicules are not necessarily a new introduction to aesthetic and cosmetics. However, Genosys have used what's called a third generation spicule. So as you can see from the pictures in this slide, earlier generation spicules were extremely smooth. So yes, they did still penetrate the skin, but there wasn't as much adherence as you will get from a third generation cog spicule. So with cog spicules, if you liken it to cog threads, obviously completely different treatment, but if you have that image in your head of how when they enter the skin, they essentially are very capable of kind of hooking to the skin where they need to. So this third generation cog spicule is also utilizing advanced coating technology. So this means that active ingredients are encapsulated in what we refer to as phytosome form. So each of the spicules are coated essentially within that with that PDRN and other active ingredients. So essentially when the spicules enter the skin, it then delivers the spicule, pierces the skin, and then the ingredients are delivered directly into the skin at a deeper level as well, which is quite important. So Biomycid PDRN ampule, I'll take you back again to both of those separate products. So we know that the Expert ampule 60,000, and we also have the Home Care ampule at 5,000. So these are both unique treatment ampules. They're enriched with that formulation of Biomycid PDRN. So it's active ingredients like your PDRN, like your panthenol, and also anti-aging complex to regenerate the skin. Now it's customizable care, that's how we refer to it, because it's a two-way system for in-clinic treatment and then of course home care to support the expert professional treatments. Again, we'll talk about frequency of use and our kind of suggested treatment program as well. So as I've mentioned, that number that is attached to both of these separate products relates to the concentration of spicules within both of them. So we have the Expert ampule at 60,000. So this is a spicule concentration of 6%. And we have the Home Care PDRN ampule at 5,000. So this is a spicule concentration of 0.5%. Both of these expert and home care treatments, they work in a similar way to how microneedling would work. So boosting skin cell turnover, we'll talk about effects on the skin when used. Now, I use this treatment I believe it was Sunday. And yesterday, today, my skin is peeling. So it does have a peel off effect, especially within first use and first expert treatment. This is something that your clients should expect. So it's promoting skin regeneration and will improve skin tone as well. So concentration is extremely important in both of these products. So if we were to look at general home care, typical products that include that speakule ingredient, normally concentration would be around 0.01 to 0.3%. Now, as you've seen, the home care ampule has 0.5%, so it is quite an intensive home care treatment alongside what we have in expert. So this gives us an idea really of how often your client should be using this home care product at home. I'll say now, we recommend that the home care product is once per week. So it is likened to a 0.25 ml needle treatment. We then have the speakule concentration of the professional ampule at 6%, which again, as you can see from the comparison there, is quite a high concentration of specules, which is why it is a professional treatment for trained professionals only. So we always start, for anybody new to the use of specules in terms of professional ingredients, we start with the professional expert treatment. First of all, once that course of treatments has been completed, that is when the clients can move on to using the home care on a weekly basis. So starting with that professional treatment, that sets the foundation for deep skin renewal. And then you support those changes, those improvements to the skin with the home care. So we look now at the technology behind the specules, how exactly they are formed, and how those ingredients, including that PDRN as one of the main ingredients, is actually delivered into the skin. So Genosys have this exclusive specule system, which is built on stabilized phytosome encapsulation technology. So this enables direct penetration of active ingredients into the skin for enhanced efficacy. Now, typical cosmetic ingredients, if there is any kind of delivery system, often tends to use liposome. So liposomes contain a lot of hydrophilic substances, but they can be broken down a little bit too quickly, or as soon as they are applied to the surface of the skin, there's always the risk that they can be broken down a little bit too quickly. Now with phytosome encapsulation, with that specule as well, essentially it is covered in a phospholipid layer. So it's that phospholipid layer within the phytosome that has better bio capability in terms of likeness to the skin's natural phospholipid or lipid layer, sorry. This essentially means that the skin tolerates the product's ingredients a lot better. The ingredients within that phytosome remain stable for longer. But of course, what we need to remember here is that it isn't just phytosome delivery technology. We have that specule within the phytosome as well. So if I was to kind of crudely explain to you how this looks, imagine that you have a toothpick and the toothpick is the specule. The phytosome with the PDRN encapsulated is like bubble wrap. Now the bubble wrap has the ingredients in. The toothpick or specule is inside that bubble wrap. So essentially, when the specule touches the surface of the skin, it obviously creates a delivery pathway via the specule, and then of course the ingredients kind of follow behind. So this is quite a unique, and you know, at the beginning I'm talking about innovation. This is really quite an innovative way to deliver product into the skin, but also create that wound healing response that we are used to seeing with microneedling. So step by step, the spicules are extracted first of all. So as I mentioned, they are extracted from hydrolyzed sponge, marine sponges. That PDRN is then encapsulated within the phytosome, and then the spicule is coated with that phytosome on the cog spicule. So then we have the ability to optimize stable transdermal delivery of product. So we have that spicule element plus the PDRN, which of course, as we'll go through a little bit later, is very active, but also very promising ingredient in terms of what it's used for, its regeneration capabilities as well. So the diagrams that you'll see here will be familiar to you in the sense that very similar to microneedling. So we are creating microstimulation on the skin. As a result of that, not only does it create delivery pathways for the ingredients, it also accelerates skin renewal, skin cell turnover, which is one of the reasons why you get that peeling as a result. And we are, of course, delivering highly concentrated PDRN directly into the skin, which in turn will promote regeneration and collagen synthesis. So I know a few of you were probably watching the demonstration and kind of trying to understand how long certain things would last in terms of post-treatment. So we've broken it down here kind of on a day-to-day basis, what to expect. Of course, remember that the after effects will differ slightly depending on skin type, skin condition, but also depending on how many treatments you've had. So first treatment would be more intense potentially than third treatment. So lots of factors to kind of consider here. But this is quite useful to refer back to when you're talking clients through what to expect as well. Having had it done as well, I can say that this does fit quite well with the after effects of the treatment for myself. So typically, and important to know that spicules are not absorbed into the body. They are embedded in the skin temporarily, and then as the skin naturally turns over, they are completely eliminated over time. And that's not something you're aware of as happening. There's no sensation involved in that. But it's just to be aware of these spicules. They're not physically absorbed into the body. So typically, and again, it will differ, but around 12 to 72 hours before the spicules are actually eliminated. So I can say for myself, when I had the treatment, sensation was there still on the skin, probably just over 24 hours post-treatment. So by this I mean, and please advise that after treatment, then they do not touch their skin too frequently. It's almost as if it is reactivated every time you touch your skin, and you can feel the sensation when you do. So normal effects of the treatment are redness, tingling, and a feeling of tightness. So very similar to sunburn, but also very similar, of course, to the after effect of microneedling. Around day 2, the redness, the appearance of the skin may have subsided, but as I've said, you might still feel that sensation when you touch the skin. Day 5, which I think for me, I was more day 4, and today is day 5. That's when I noticed the most skin shedding. But again, that could be because this is the first time that I've used the Expert Ampule, so therefore slightly more intensive. And once that peeling slows down, skin may appear brighter with reduction in pore size and, of course, softer effect in terms of lines and wrinkles. So the mechanism of this Expert Ampule, of course, is biomicroneedling. So microneedling without the need for needles. And this is your exclusive Genosys spicule system, Biomiso. This is delivering PDRN, polydeoxyribonucleotide, in phytosome form directly into the skin. So this has both a skin revitalizing and anti-aging effect. So microstimulation promotes skin turnover, but also we're talking about how the skin regenerates, and obviously PDRN is one of the main ingredients that we focus on here, but we also have growth factor peptides, panthenol, which is very supportive for the skin, and a complex of 5 ceramides. These also help to strengthen and support the skin's natural barrier and resilience. This treatment is fantastic as an anti-aging treatment. Obviously, the PDRN extracted from salmon milk, so we will go through the ingredients individually. And the anti-aging peptides are absorbed along the Biomiso pathway. So that is the pathway that is created through the use of the spicules. So here we give you our recommendation in terms of how often we should be carrying out professional treatment, how often we should use the home care, and where do we begin. So with that in mind, as I've already kind of mentioned, we want to begin with the expert treatment. At this point, when we're undergoing expert treatment, we do not use the Biomiso home care. Of course, we would recommend that they use Genosys home care that reflects their skin condition and their skin type. So recommend the correct products for home use, but also make sure that those treatments, professional treatments, are 4 weeks apart. So here we have first, second, and third month. Then 4 weeks after that final treatment is when you would introduce the home care. Once you get to the point of home care, it would be once weekly. It is quite an intensive home care treatment with the likeness of a 0.25 microneedling treatment as well. So that is why we space them weekly. As with any treatment, we need to take precautions. So we are using microneedle-like spicules. So we still have to be very careful in terms of client selection and of course how we use the product. So I think it was mentioned during demonstration, we don't use the product around the sensitive eye and lip area. So we completely avoid those areas in treatment. Also be wary of skin that has undergone any other treatment. So that could be any treatment within an aesthetic arena and beauty arena. So laser, also microneedling, radiofrequency, IPL, any treatments like that, including injectable treatments, always have a space of 4 weeks in between each. With pustular or acne-prone skin, this is a skin type that is always already kind of pre-inflammatory anyway. Also the fact that there will be bacteria there. So what we don't want to run the risk of is spreading that bacteria, increasing inflammation any further. The same applies to skin with rosacea. So rosacea will have quite high vascularity, potentially transepidermal water loss, impaired skin barrier. So we need to be obviously very cautious with that skin type as we run the risk of increasing vascularity and sensitizing the skin too much. Any viral inflammation or any skin with open wounds. So depending on skin type, mild irritation can last up to 3 days, and that exfoliation will occur around 2 to 3 days after treatment. So looking now more towards the key ingredients of this product, but also how we use it, how often we use it. So this slide gives us the protocol as has been demonstrated. So step by step in terms of what we use and when we use it within treatment. But to take you through some of the key points of the expert ampule, this, again, to reiterate, is for professional use only. Each ampule, as you'll see here, is 3 mils. So that single ampule is enough for one single treatment. As you can see, Hannah applied it to the skin directly from the ampule. So that is to avoid excessive activation of the spicules at the beginning of treatment. So as I've mentioned, in terms of concentration of spicules, we have 60,000 ppm for the professional, and that gives us 6% spicule content, so a very high percentage. Spicules, in terms of how many spicules are in per mil, so we look to 300 to 360,000 spicules in each individual mil of product. So bearing in mind that a professional product will be 3 mil, we are looking at almost 1 million spicules per professional treatment. So really, really high amounts. Again, that's why we have that month in between each treatment, is to just make sure that the skin is properly healed in terms of after effect. Panthenol at 1% plus 5 ceramides. We also have within the ingredients 8 anti-aging peptides and 9 growth factor peptides as well. As I've mentioned, it's the equivalent to a 1mm needle. Therefore, we recommend that we do this no more frequently than once per month. So this is a good slide to refer back to in terms of treatment protocol. Obviously, the protocol is extremely similar to how we would carry out a professional microneedling treatment, such as activating the skin with the EZCO2, how we apply the expert ampule, making sure, I think, and to reiterate the point, that we are not massaging the ampule for too long, but we can also, as an occlusive, use the hydrosoothing cream, which of course, when we use the hydrosoothing cream in other treatments, we're used to it being quite a calming product. Whereas with this, it is used for occlusion and just to intensify the treatment. So if you are carrying this treatment out for a client and they struggle with sensation, they found it to really sensitize their skin, then this is the step that you would skip. Professional mask post-treatment, you either use the Bioferment age-defying mask, which you've seen. And just to reiterate, the default mask in terms of treatment would be the PDRN reboot mask. However, if again the client is highly sensitized, that's when you would use the Bioferment powder mask. Finish treatment with soothing repair post cream and also potentially skin rescue overnight cream mask. You can, as was demonstrated, apply blemish balm post treatment as well. So we see a list here of included ingredients, all kind of there for specific effect. So we have anti-aging effect, we have skin revitalizing effect, and we also have barrier strengthening as well. So within that anti-aging, we of course have PDRN, we have collagen, elastin. We then have 8 anti-aging peptides in there also. For skin revitalizing, we have growth factor peptides, 9 in total. And for barrier strengthening, again, we have that PDRN with its regenerative capabilities, panthenol, 5 complex of ceramide, and also phytosphingosine to support that ceramide within the product. So the biomeso is the main function of both the home care and the expert ampule. So this is the PDRN encapsulation in phytosome form, and the spicules are derived from hydrolyzed sponge. Now, I do want to touch on PDRN as the ingredient. Again, I know in the UK that it has kind of ramped up in terms of popularity. It is quite popular in terms of injectables. And and we refer to them differently. So when we have sodium DNA within products, within cosmetics, we refer to it then as PDRN, but for injectable and more medical treatment, we refer to it as polynucleotide. So slightly different in terms of how we refer to the ingredient. So this is salmon-derived DNA, and its efficacy comes from the fact that it has 95% similarity to human DNA. What I want to talk about specifically with this ingredient is that likening to salmon sperm. So this is kind of the way that I see it described as. And I think it's important for yourselves as trainers to perhaps maybe alleviate some concerns with the ingredient being described in that way. So what we don't want you to do is kind of refer to sodium DNA in that sense. So we know it's a well-known ingredient, and the actual sodium DNA is filtered to a point where its DNA components are the last thing that remains. So essentially, when it gets into cosmetic form, there is no salmon sperm left at all. So just to make it clear that it is filtered properly to its correct molecular form. So we get the best out of what is known as salmon milt, is where the ingredient is derived from. So this particular ingredient accelerates cell turnover. It is high in terms of its anti-aging effects, also collagen supporting and elastin synthesis as well, but it can help to support the skin barrier function. We have panthenol at a percentage of 1%. So this is a skin protecting vitamin. We see it quite a lot in some of the Genosys products, and it helps enhance the skin barrier and deliver deep hydration to the skin. We also then have phytosphingosine, which, as I've mentioned, acts as a precursor to ceramide. So it helps improve that ceramide synthesis in the skin, which takes us then to the CeraShield 5, which is a complex of 5 different ceramides. This helps the product to have that affinity to the skin. So it helps improve barrier function, it helps reduce transepidermal water loss, and it protects against external irritants. So not only with these products are we creating skin regeneration, but we are also giving the skin protective elements as well. The anti-aging peptide complex is a complex of 8 different peptides. So of particular interest here, you have copper-tripeptide 1, which is one of the most studied within aesthetic products. It is known for its ability to promote collagen and elastin synthesis. We also have acetyl hexapeptide 8, which is commonly known as arginine, which is directly for reducing line and wrinkle expression. And then palmitoid pentapeptide 4 is commonly known as matrixyl. And the last 2 peptides you see here in combination together, they are referred to often as matrixyl 3000. So this it allows for collagen synthesis, but also to help reduce inflammation and soothe the skin. So in combination, that peptide complex gives us anti-wrinkle capabilities, firming, tone improvement, and also soothing for the skin as well. So we then have the 9 growth factor complex, and this is quite a highly stimulant element of the ingredients. So this allows skin regeneration and supporting healing and collagen synthesis. So we move on now to the home care ampule 5000, 0.5%. And we see that in terms of how this product is formulated. We know that it's for home care. We're going to use it once a week as it's equivalent to a 0.25 needle. And we have 0.5% spicule concentration with around 25 to 30,000 spicules per 1 ml. Again, I would recommend that per use at home, you would be using roughly around the same as your professional treatment. So roughly about 3 mils in total. Perhaps you didn't see in demonstration, but we have a dropper application for the home care product as well. Within here, we also see the same ingredients as we have in the expert ampule of the panthenol, 1%, the complex of 5 ceramides, and the 8 anti-aging peptides. The difference comes with the growth factor element. Instead of the 9 growth factor peptides, we just have epidermal growth factor. And again, in terms of protocol and how we use this at home, we see step-by-step guide. Obviously, as this is home care as opposed to expert, we take out the steps such as your EZCO2 application. And we would also be using the PDRN reboot mask at home. What's important to remember with both professional and home care is that we are not removing the PDRN ampules off the skin when it's been applied. We are simply kind of layering products as we move through the protocol. So we still have that anti-aging, skin revitalizing and barrier strengthening components of the product. As I mentioned, instead of 9 growth factor peptides, we only have the epidermal growth factor within this particular home care. Ingredients are the same. So PDRN encapsulation in phytosome form. We have that sodium DNA, 95% similarity to human DNA, 1% panthenol, phytosphingosine, 5 complex of ceramides, and also that anti-aging complex as well. Now it's that epidermal growth factor. What we want to try and achieve with home care is stability of the product. So having less growth factors makes the product more stable, but it also reduces the intensity of treatment as well. So having epidermal growth factor in there helps with anti-aging properties, but also that wound healing ability as well. So moving on to the final product of the 3 we want to cover today is the Skin Reboot PDRN mask pack, which of course you've seen in demonstration. So this is another mask to add to the potential masks that you use in professional treatment. Slightly different in terms of how it's kept. So obviously we're very used to single use, open the packaging, whereas with this we have 30 masks in total, each kind of removed with the tweezers every time we want to use one. So Skin Reboot PDRN mask pack is bulk format, 30 sheets in each pack, and it is designed specifically for restoring weakened skin and to deliver intense nourishment as well. So this gives the skin the ultimate reboot with regenerating ingredients that we've seen already. PDRN and that 1% panthenol is in there as well. So they are ultra thin. Of all the masks that are available through Genosys, this is the finest mask that they have. As you could see, there was excellent skin adherence. We have looked at uniformity test in terms of how the ingredients on the mask are absorbed and distributed. So as you can see here under a microscope, that uniformity of distribution of the ingredients means that it's nice and even when applied to the skin. So we have that salmon milk PDRN extraction, we have the barrier strengthening panthenol, and we also have again that 5 ceramide complex. So it feels watery, it feels very lightweight, and of course is quite cooling post-treatment, which we need in terms of this particular treatment. as with most of Genosys products, we do a lot of clinical studies. So this particular study has been carried out on the PDRN reboot mask. So what this shows is it has improved or reduced transepidermal water loss post-treatment. Not only that, so we see a 34% improvement there. And we have also seen how it can improve the skin after physical stimuli. So a number of different participants have been tested, and what we've seen is a variation in terms of skin improvement or barrier strengthening afterwards, so around 40% improvement after using the mask. What we will be doing in the coming months is looking at more clinical studies, clinical trials regarding the two products that we've covered previously. So what we'll be looking at specifically is skin absorption and skin recovery as well. So those obviously will be available to you as soon as possible. We have then product satisfaction survey, of which 100% of people that used the mask were completely satisfied in terms of fragrance of product, feel of product, willingness to kind of use the product again and purchase the product. So again, looking at ingredients, we have a slightly different element to this mask that we need post-treatment, and that is the cooling, calming element. So we have that powered by xylitol, so no menthol or alcohol at all. Just want to kind of add in there as well. One of the benefits of the mask is it's completely biodegradable. That lyocell sheet is created with very natural fibers. Therefore, it makes it completely biodegradable. So we have that cooling element. Again, we are strengthening the barrier and also the anti-aging elements of PDRN, collagen and elastin. How we use, you've seen this in demonstration, so you remove each individual mask with the tweezers that are supplied. Always make sure that, of course, when you are finished with the pack, you close the seal, you close the lid properly to avoid any moisture loss from the masks that are in the pack. When we use it in treatment, we are using it for 10 to 15 minutes. Sometimes intensive heat that you might get from the skin, it can absorb the ingredients on the mask that little bit quicker, but for a normal skin type, you're looking at anywhere from 10 to 20 minutes, really, of application time. What we also want to point out here is that you can use the PDRN mask with LED, so in conjunction with LED at the same time. Because the sheet is so fine, it has excellent light absorption through the mask. So you can enhance the treatment even further, should you wish to do so. Key ingredients, again, we see very similar, even in concentration. So that PDRN concentration remains slightly less, but at about 0.1% in terms of PDRN concentration. But we also see then the 1% panthenol, not 5-complex, it's actually ceramide NP, which you'll be familiar with from the barrier repair cream, allantoin and phytosphingosine. Then we have the same anti-aging elements and moisturizing and soothing. So we go through the same ingredients again, but we have the addition of shea butter, which is your skin-friendly plant-derived emollient, vitamins A, E, and F, which give antioxidant protection. But important as well to remember, shea butter doesn't clog the pores. We then have the green leaf complex, which is a mix of 3 different extracts. We have tea extract, menthol extract, and thyme leaf extract. So these give natural antibacterial and soothing properties to the skin. So very important, of course, post-treatment. So that is presentation done. I can't see the chat box. Okay, Shannon, PDRN mask, during me keep your right foot, you will have seen it in the home care protocol as well. So this is something that you can incorporate into home care use. Any other questions at all?
Gillian, can you hear me?
I can, hello.
Oh, hello. Sorry, I actually don't know why my camera's off there. Just when you mentioned there about incorporating it into home care, would you sell the pack to an end user?
Yes, yeah, absolutely. So you would sell the full pack to your clients. And
Oh,
they can, again, store them as long as the seal is tight and the lid is closed, they will keep absolutely fine. Again, probably recommend once weekly use alongside the home care should it be needed.
Oh, perfect. That's brilliant. That answered my question. Thank you.
You're welcome. Thank you.
Oh, yeah,
When are they available to order?
yeah. So thank you, Jill.
Thank you.
Yeah, so now then I will give you some information about the background and when it's available, etc. So we are targeting, our plan is to be able to deliver the products from the end of August, but maybe from September. And always, there's some problem. And so the clinical trials will be ready when the product will be launched, as Gillian said. And so why we are launching this product. So this is, okay, trainer session, but the product will be available in September. So this session was prepared to make our trainers be informed prior to launching, okay? And yeah, to give you maybe enough time to study. And anyway, we will provide all the training materials as soon as possible. And actually, so spicule treatment is not something new. And as a microneedling expert, we were not considering launching a product which is, let's say, no needle microneedling. So since we believe that microneedling with devices and rollers is really great to perform, but indeed there are people who want to have a very effective treatment with a minimum downtime, etc., but who are afraid of needling. And thanks to our Czech client, we were refusing until now to develop like no needle microneedling treatment, but the pressure was quite strong, and so we started working on it. And also we are an expert of microneedling, so we have the full products, pre and post products, which are perfect to do spicule treatment, which no needle microneedling. So this is why we decided to develop the new product, new treatment. And so we are quite happy because we are all very happy with the treatment effect. In the market, there are professional products. There are also retail products. Like from already like 2022, some some manufacturers started launching like a spicule cream, like this kind of things. But in 2023, the most, let's say, popular retail brand as a spicule treatment, like a Riddle shot, was launched. And but and other
Да, я считаю, что две цели.
I muted, sorry. So other brands, they don't really share the concentration of spicules. but okay, we do. The concentration was set at the level, let's say, which can really have the best result without side effects. So a lot of experiments were done, and so that's why it's kind of high for professional, let's say, treatment, so 60,000 ppm. And for home care, it's also relatively high, but still it doesn't over stimulate the skin. So it is safe. And maybe you're all skincare professionals, so you all know herbal peeling, sea algae peeling. So these kind of like peeling products exist since a long time, okay, with different brand names. And usually these treatments incorporate, let's say, powder. So like needle like structures, molecules, and in a form of powder, they do this peeling. Okay, we do like massaging, and the powders like herbal powder or algae powder go into the skin, and they do this peeling effect. The difference of our product from this kind of conventional peeling product with powders. Powders, when we look at these powders, it's not only like pure herb substance or pure algae substance, which our skin needs to have this peeling effect, but there can be some other materials which we don't really need. And so, well, and in our biomeso PDRN ampoule, firstly, the spicule is so 99% high purity spicule, and it can be, so the formulation, when we look at the formulation, this kind of, so this spicule is coated with PDRN, and also, so our, let's say, the viscosity of our ampoule is quite thick because this is silica. It's not really dissolvable in water, but it should stay as a liquid until we use on our skin. So the viscosity of our liquid should be quite high to make it kind of temporarily soluble in our formulation. And when we make a product, cosmetic product, we should do all kind of stability test. So it's all done. The stability wise, there's no problem. So we could safely mix, so the spicule and all the liquids, peptides, growth factors, and ceramides, etc., in a stable way. So this is also a difference from conventional peeling method, let's say, which is performed in aesthetic field. I can say like that. And yeah, I think so. Let's say the fact that there are already retail spicule products in the market, it's, let's say, it's not only a threat to us, because people who are highly involved in beauty treatments, if they already tried, let's say, like a retail speaker treatment, they know a little bit like how the skin feels, how the skin changes. But the concentration and the effect of Genosys biomeso PDRN expert ampoule, when it's applied as we introduced you today, it's really like wow effect. When I tried on myself, like I was like in the beginning, I said, okay, never again. I will do this treatment never again. But 5 days later, when I looked at the mirror, what happened? Oh my God, it was really wow effect what was there. And like giving birth I forgot how it was and do again. So it really gives a super glow effect on the skin. So we say Korean glass skin, like it's another keyword of like K-beauty. So Korean glass skin, you can teach your clients that they can have this Korean glass skin effect when they experience this new treatment. So as I said, the launching will be in September, but you are informed in advance. And we are also now already like doing a design of new clinical trials, kind of combination with lasers, these kind of things. So it's in the pipeline. So any questions?
So does that mean, Tommy, that there may be protocols with devices, so using it alongside, like you mentioned there, with lasers or?
Yeah, it's our plan. It's our plan.
Oh, that's fantastic, because we have a high demand of clinics with devices at the moment. So if we can use it alongside, that would be fantastic.
Mm-hmm. Yeah, okay. Yeah. So we all know what our clients will ask, so we are trying.
Yeah,
Yeah.
that's brilliant.
The recording, I will stop here. So